Hello everyone, hopes all of you are fine and welcome to my channel. Today we will discuss about physiotherapy care for ICU patients. Before discussing about physiotherapy care for ICU patients, we will assess each and every system of the patient's body, that whether his system is stable or not, to compensate or to perform any physiotherapy exercise. First of all, we will do muscular assessment. In muscular assessment, we can assess patient's condition by changing the position of patient, because ICU patients even can't able to bear range of motion, and if we will change the position of patients, their symptoms will aggravate. Next is neurological assessment. In neurological assessment, we will calculate GCS score of patient, which is called as Glasgow Coma scale. 15 is normal and 15 is total GCS score, and below 7 patients are in coma. We will check for pupil size of patient, whether the pupil of patient is dilated or not. We will check for intracranial pressure. We will measure the intracranial pressure of patient by different devices, because if the intracranial pressure fluctuates during exercise, then the physiotherapy is contraindicated for that patients, because patient's brain death can occur due to fluctuations in intracranial pressure. Now we will discuss about cardiovascular assessment. In cardiovascular assessment, we will check heart rate and blood pressure. Also, we will check arrhythmia, and if arrhythmia is present, then physiotherapy is contraindicated, because arrhythmia is present in condition of atrial fibrillation and ventricular tachycardia, and in these both conditions patient is unstable and physiotherapy is contraindicated. Okay, now we will discuss about we will check about strength and quality of pulses. We will check strength and quality of pulses by grading. There are 4 grading. If patient lies in 0 grade, then there are absent impulses. If the patient lies in +1, then weak and thready impulses are present, and if the patient lies in +2, then normal pulses are present, and if +3 grade is +3, then bounding pulse is present. Bounding pulse mean high intensity pulse. Now we will check the deep vein thrombosis. In unconscious patients, deep vein thrombosis is checked by patient files, reports and ultrasound. But in conscious patients, we will check DVT by Hoffman test. In Hoffman test, when we will squeeze the calf muscle of patient, there is severe pain in the calf muscle, which is the indication for DVT. But in unconscious patients, they are unable to tell about pain. That's why we will check patient's reports, and we will perform ultrasound to check for DVT. Now we will discuss about respiratory assessment. In respiratory assessment, we will perform auscultation, percussion, ABGs, which includes partial pressure of oxygen, pH, and partial pressure of carbon dioxide. In renal assessment, we will take history of patient. We will perform renal test. We will check for edema, infection, proteinuria, hematuria, and by renal assessment, we are checking that patients, how much patient has capacity to do exercise. Next is immunological system. In immunological system, we should take care of the safety of both physiotherapist and patient. Physiotherapist should wear glasses, face masks and head caps. He should also wear aprons to avoid contact with the blood, because blood is easily discharged from the ICU patients. He should also keep PP, means personal protective equipment. Last one is GIT assessment. GIT assessment, in bedridden patients there is constipation. To avoid constipation, we will perform abdominal kneading. Abdominal kneading is performed in the direction of large intestine. Ask patient to perform abdominal kneading in the direction of large intestine. Ask patient to start kneading from right, go up from right and then left, and then come downward in the direction of large intestine. That was all about our today's lecture about physiotherapy care for ICU patients.